right, Lena.
Okay.
You're on.
Action.
Action.
How did you come to the Institute?
When I finished graduate school, I entered a postdoc program through the Robert Wood Johnson Foundation, and Hal Luft was one of the faculty on that program. So I got to know Hal Luft, who was the former director at IHPS, through that program. And at the conclusion of the program, Hal and I had a series of conversations. The Cancer Center at UCSF at that time was expanding its population sciences work. So Hal, in cooperation with Margaret Tempero at the Cancer Center, arranged for me to come to IHPS as a faculty member. I spent actually a couple of years attending the IHPS Works in Progress seminar before joining the faculty, so really got to know the institution well, got to know Hal well and the other faculty, including Phil, who was around occasionally at that point before he came on board at IHPS.
Oh, very good. What were the motivations for you taking on this area of research?
So when Hal first brought me to UCSF, a lot of my work was focused on inequalities, and not so much on health inequalities, but as I came to UCSF, I began to focus more and more on vulnerable populations and health disparities in cancer care, and thinking about ways for the healthcare system to better address the provision of care to diverse populations. So that was something that I had researched for many years in graduate school in terms of my work on urban poverty. And then I was able to spend a couple years doing work on cancer care in diverse populations when I first came to the Cancer Center and to UCSF. From there, my work has really expanded into broader issues around cancer discovery and drug discovery and issues related to health policy and the development of new technologies and how those are applied for diverse populations, for vulnerable populations. So that's the areas where I'm mostly working now in terms of my research is on how folks get involved in clinical trials, how diverse populations get involved in clinical research, how our healthcare system is providing care to vulnerable populations, and how to make all of those processes work better and smoother and more efficiently, as well as more fairly, so that folks in the United States have a better chance of getting equal treatment when they go for healthcare.
What are the biggest challenges to conducting rigorous and relevant work in these areas?
So I think in the work I do, it's mostly qualitative research. So we spend a lot of time watching doctors and patients talk to each other and really understanding in an in-depth way how care is delivered. That's great for understanding in great detail how patients and doctors talk to each other. It's challenging to broaden that and come up with generalizable findings that will work across many different systems and for many different patients and providers. On the other hand, other health services researchers will do research with large databases, but they won't have the depth of detail that we get from our qualitative and ethnographic studies. So the big challenge we face is how do you strike the balance between getting in-depth, detailed stories and descriptions of healthcare delivery and also understanding the general patterns, because you kind of need to understand both things to have effective health policy. I think this is something that Hal really embodied in his own work, finding both the general patterns as well as the specific instances that make health policy work. It's certainly something that the Institute has always been focused on, has been a hallmark of research at the Institute for many, many decades. So that's the issue we grapple a lot. When do we need more depth? When do we need to step back and get a broader picture? How do you balance those two issues? And then how do you bring that message to the people who can affect policy or create change? Because oftentimes the messages that we find in our research are complicated. It's not a simple story. It's like you need a little bit more of this, but not too much of that. That's a hard thing to communicate to policymakers, and that's where we spend a lot of our time thinking about our work and how to improve it.
How have IHPS and your collaboration through the Institute supported your work?
Really in crucial ways. So as I mentioned, when I first came to UCSF, it was in a very collaborative way. It was not just the Institute, but also the Cancer Center. In fact, at the time, Philippe Bourgois was in the Department of Anthropology, History, and Social Medicine. He's someone who does a lot of work on urban poverty and urban ethnography, so he was a crucial player in my coming on board at UCSF as well. So it's always been collaborative for me. The Institute has always been sort of the home base, but I've always worked with people all over the university, and increasingly around the state and around the nation as well on research projects. So I'd say some of the folks who have been affiliated with the Institute who've helped me think about my research in creative ways, Hal, of course, Elisa Barrow and her work on conflict of interest and research integrity, Stan Glantz showing how to use research for advocacy purposes, Adams Dudley, whose work is very rigorous around issues around quality of care and how to measure healthcare quality. It's not that I necessarily collaborate with each of those people or even use their same methods, but that spirit of understanding how research should inform policy is something that's very important to me and that I've learned at the Institute. Now I'm working with people at UCLA, at the Palo Alto Medical Research Foundation, at University of Chicago, and all of those collaborative relationships have come through connections through IHPS. A key collaborator on a current project is Elizabeth Boyd, who is someone that I met at the Institute when we were both postdoctoral fellows. She's now the Associate Vice Chancellor here at UCSF. So these connections through the Institute have been crucial really every step of the way in my developing career and in sort of refining my research interests.
What do you think is the most impactful outcome of your work?
I think we'll find out in the next couple of years. The project that I'm working on with Elizabeth Boyd, and we're collaborating with a pathologist at UCLA named Sarah Dry, is to really rethink how some major pieces of research are carried out within the University of California. And we're looking at ways to improve what's called biorepository research, or research where people give tissue samples to basic scientists who then look at the genetic patterns in those tissues and try to advance science in that way. That's very, very important research, but there's some important health policy issues associated with it. The data that comes from that research can be quite sensitive, so you need to be thinking about people's privacy. The results of that research are really unknown. It's a new field of genetic and genomic medicine, personalized medicine. The implications are huge, but we're not sure what they are. So through that project, we're trying to establish a new foundation for these types of biorepository research throughout the University of California. And we anticipate in 2 or 3 years that we'll have a new system for how this research is conducted, how these tissue samples are collected from patients, the types of consent that people give, and the way the data that results from that research is used and managed. So we anticipate that's going to be quite impactful. We're still probably 2 or 3 years from seeing the results of it.
Can I ask you a follow-up of that? Are you looking for genetic signatures, kind of like the causes of diseases at a genetic level? Is that part of what you're hoping to find?
This research involves 2 very important kinds of questions. One question is for individuals who have an illness. That could be something like cancer or asthma or other kinds of illnesses that have some sort of genetic basis. This research helps identify which people will respond to which kinds of treatment and how to personalize their medical care in ways so that we make sure we give them the treatment that's most likely to be effective. That's one type of result from this research. The other kind of research is to understand which people are susceptible to which diseases. And that is from healthy people to understand, are you more or less likely to get a certain type of disease or condition? How can we anticipate that and prevent it? And how could we take steps or help you take steps so that you don't have such devastating consequences from that illness or disability or disease? So those are both types of research that will come out of these kinds of biorepository studies. One is a genetic kind of research on specific diseases and conditions. The other is genomic research about your individual, the makeup of your DNA and what diseases that makes you more or less vulnerable to. There are important privacy implications for both of those and important policy considerations for both of those kinds of research. But in a way, these biorepositories are like the foundation of all of that research. So we want to make sure that we get the biorepositories working correctly so that all of the other things that come from that resource will also work well.
Okay, that's great. Thank you.
What outcomes are you most proud of?
think at this point I'm very proud of, in addition to my research, I do a lot of work in training at IHPS. And we've been working hard to think about how to take the vision for training that Phil Lee and Hal Luft and Claire Brindis have articulated and supported for many decades, how to make that relevant for our current times. So I'm proud of the way that we train people. I'm proud of the fact that we emphasize interdisciplinary research, that we underscore that no one discipline has it right, that we need to have collaboratory and cooperative research. We have a broad vision for health policy and how to improve the world. And I'm proud that we're continuing to move forward and find ways to keep the Institute relevant in terms of its training activities. So we're actively developing an online degree program that we feel is going to help people throughout the country and perhaps throughout the world really understand the IHPS way of doing research and informing policy. So at this point, I'm very proud of our efforts in that arena. And again, it's a place we're actively developing, and I expect we'll see some interesting results in the next 2 or 3 years.
Can you make a statement about the online training? I think that's something we could use as a clip.
Yeah.
Just kind of collect a thought about what you can say about that.
The Institute is developing an online degree program in health policy and law, which will bring together health services research and health policy research along with health law and legal analysis of health policy. And we want to make this program available throughout the community here at UCSF as well as in California and the nation. We think this will be the first of its kind that we know of that will really help advance health policy research and training into the 21st and 22nd century, hopefully.
Okay, thanks.
Sorry, I don't know what we're doing yet, Jay. Honestly, so
Work in progress.
exactly.
We'll leave that part out. How did you become involved in education and training activities? Do I add them all at the same time, or what are the challenges in these area and
Let me
opportunities?
see what you're asking.
What do you think is the
Oh, you can ask.
Did you put over challenges and
It
opportunities?
seems like it could be rolled into one question.
Yeah, why don't you make one question out of
Okay.
that?
Okay.
How do you become involved in education and training activities? What were the challenges in these areas and the opportunities?
I became involved in training as a natural extension of my postdoc, actually. I was here and participating in the works in progress sessions. Hal Luft and Drummond Rennie were running that seminar at the time. I really enjoyed it. I found it a very invigorating and refreshingly honest forum for exchanging ideas, I would say, especially with Drummond Rennie, who has a way of presenting things in a very frank way that's refreshing. And I am not exactly sure why Hal asked me to step in and serve in the role of Associate Director for Training, but it was a role I was really happy to assume and an opportunity I've been happy to pursue for some time now. One of the first things we began to do in that was to think about how to institutionalize health policy training at the Institute and develop a degree program. And we've made several different attempts to come up with the right formula for health policy training at UCSF and a health policy degree program. The Health Policy and Law joint degree program with UC Hastings seems to be the right combination. It's a joint program that brings the strengths of the two institutions together in a unique way. It's an online program, so it's something that we'll be able to offer to students all over the state and all over the world, hopefully. And it's a resource that we think will really help us think through policy issues, especially as the Affordable Care Act is implemented over the next few years. So we see a need for it. That's the great opportunity. The challenge, of course, is to make sure that the program is set up in a way that it stays relevant, that it stays sustainable, that it draws on the interdisciplinary strengths of our faculty in a way that students find understandable and compelling. So that's the challenge we'll need to face as we develop this program in the next few years, but I think the payoff will be substantial if we're able to do it right.
What aspect of your work or activities at UCSF is most exciting to you?
Recently, Claire Brindis instituted an advisory board for the Institute, and we had one meeting of the advisory board last year, and we'll be having another meeting of the advisory board soon, in February of this year. That has been tremendously exciting to see people from across the country come together and to really think about what the Institute does well and how we can do it better. To see that the kinds of issues and ideas that we think about at UCSF actually have a lot of relevance and resonance throughout the health policy community. That's been very exciting to find. I've spent in the last few years more time in Washington, D.C., mostly at the National Institutes of Health, but in some other areas as well. And it's been exciting to realize that out here in California on the left coast, we do think a little bit differently. We do have a particular spin on issues that is unique. And that's exciting to find out about how we can make that contribution and the unique contribution we can make as an institute here in California, in San Francisco.
What do you think is the value added of having the Institute?
There's no place like the Institute anywhere else that I know of. It's because it's interdisciplinary, because it's across all 4 schools, because it's at UCSF, which is a very unique place. It's hard to duplicate what we have here. Although we are a health sciences campus, and that introduces certain limitations. We don't have a Department of Economics or public health school or sociology department to draw on for our strengths in those disciplines. We are very close to the clinical enterprise. We're very close to the basic science discoveries, and that allows us to think about health policy issues in a different way than most places. So we avoid some of the siloed thinking that I think you can get into when you have the disciplines sort of keep to themselves. And I think that makes IHPS unique. We have a very collaboratory spirit. We like to help each other out, and we like to exchange ideas and sort of push each other further.
That's an interesting thought, too. The siloed thinking.
Yeah.
You want to think about maybe making a statement about how IHPS is different because it encompasses more rounded thinking rather than focused, narrow thought.
You want me to just say something about that?
Yes. And start out by the
I'll
difference
frame it.
between...
Yeah. Sorry, I'm not getting informed. One of the real challenges in health policy is to avoid sinking into our separate silos and just talking to each other. It's hard to make progress on a policy issue if the economists only talk to the economists and the policymakers only talk to the policymakers, and there's no exchange back and forth. UCSF is a unique institution in that the silos are a little bit lower here and a little more porous. People do tend to go from discipline to talk to each other. And I think IHPS is really a perfect example of that spirit. At IHPS, the silos almost don't exist. It doesn't matter that in the faculty meeting I'll be sitting next to an urban planner on one side, an engineer on the other side, across from the room is an orthopedic surgeon. Those kinds of differences don't impede our conversation and our exchange of ideas, and I think that's a very, very special piece of IHPS and reflects our history. It's been 40 years without any silos, and maybe that should be our new motto, should be a grain silo with a big red X through it to point out that that's part of what makes IHPS special. No silos.
No silos here.
We like that one.
That is good. Thanks.
Are there any special things about IHPS, and do you have stories?
Well, I think I was thinking, to some extent, when you think about IHPS, you think about the lack of silos, but really when you think of IHPS, you think of the food and how the whole institute comes together around sharing food and sharing company with each other. We need to do it more. I think we always love when we find the excuse to get together, whether it's our white elephant exchange in the winter or celebrations that we have of different events that occur throughout the year. But we should do more of it, actually. It's a special thing about the Institute also. And again, that reflects San Francisco, where it's all about the food. But I love the fact that people have that spirit at the Institute and like to come together and spend time together in a casual way, sharing that part of their lives and not just focused on work all the time.